The Caveat trial was an investigator-initiated study done to examine the role of Venetoclax, which is a new BCL2 targeted therapy in combination with intensive chemotherapy for older patients who are fit to receive intensive chemotherapy with respect to AML. So we have done previous studies whereby we know that low-dose chemotherapy in combination with Venetoclax produces very impressive response rates on the order of 62 to 67%. What the goal of the current study was to see whether adding Venetoclax to more intensive chemotherapy traditionally given to younger patients would further improve these outcomes, and also whether this was a feasible and tolerable approach for patients. So this was a collaborative study done by 4 hospitals in Melbourne, Australia. We recruited 41 patients and we combined Venetoclax with a 7-day pre-phase to maximise the levels of the drug prior to introduction of 5 days of chemotherapy. The chemotherapy we used included Ara-C at a dose of 100 milligrams per metre squared as a 5-day infusion, in combination with 2 days of Idarubicin, which is an anthracycline drug. We found that with this approach in 41 patients, we could escalate Venetoclax up to a peak dose of 600 milligrams, which is similar to the doses being used in low-dose chemotherapy combinations. Overall, the study had a complete remission rate and incomplete remission rate of 71%, which is certainly quite promising compared to historical studies. Furthermore, we looked at the toxicity of the regimen in induction and consolidation. In terms of induction, there was no unusual toxicities that we observed, and we also found that the time to neutrophil and platelet recovery, which is a sign of hematopoietic toxicity, was 25 days, and again very similar to what we would expect. In consolidation, we used what's called a 2+1 consolidation approach, which was only 2 days of Cytarabine and 1 day of Idarubicin. With that, we found that the degree of neutropenia and thrombocytopenia was also quite substantial, and that the times to recovery of neutrophils and platelets was actually perhaps longer than we would have expected, indicating that this was quite a myelosuppressive combination. In terms of longer-term outcomes, it's still very early in the study and our follow-up needs to continue further, but certainly our results with induction would suggest that taking Venetoclax into the younger patient population with intensive chemotherapy is certainly a viable approach.